Hello, everyone. I'm Becky Johnson, Vice President for OSU Cascades. And on behalf of OSU and OSU Cascades, welcome. Thank you for joining us today to discuss the TRACE COVID-19 study that will be happening in Redmond this weekend. OSU's TRACE project is supporting communities in Oregon by providing valuable information about the presence and spread of COVID-19. This information allows public health officials to target their efforts based on the results. TRACE community prevalence testing was one of the first community COVID-19 sampling studies in the nation, and it brings together OSU experts across many disciplines, and we'll be able to hear from some of them today. TRACE Community was launched in April 2020 in Corvallis, and since then has sampled 5 communities, including Bend in May. And those of us at OSU Cascades are really pleased that our connection to OSU to bring this type of expertise to our region. In addition to supporting the TRACE team with our facilities at OSU Cascades, this is a wonderful opportunity for OSU Cascades students to get involved in a major research and outreach project. In addition to doing testing in communities, TRACE also provides campus prevalence testing, including here on the OSU Cascades campus, every other week when faculty, staff, and students have access to free testing. So I especially want to thank our partners, the City of Redmond, COCC, and Deschutes County Public Health for their support in bringing TRACE to Central Oregon. I know the results of the study will be valuable and will help our efforts to address the pandemic in our region. And at this time, I'd like to introduce Steve Clark, OSU Vice President of University Relations and Marketing.
Thank you, Becky, and thanks to each of you for joining us today. In addition to Becky and myself, we have 4 experts in both community leadership and public health leadership, 2 from the university and 2 from Central Oregon. As Becky shared with you, Oregon State has been committed to helping to provide for an understanding of the prevalence of the virus that causes COVID-19 among Oregonians in Oregon communities since last March. We began an effort in April by doing sampling in Corvallis, and that spread, as Becky offered, to numerous other locations: Bend, Newport, Hermiston, most recently Eugene, and now Redmond. Our efforts are both to provide a sense of awareness of the COVID-19 health of a community at a given time, but also to foster individual knowledge among people who do participate in the sampling that will occur this weekend in Bend of their immediate COVID-19 health. So if tested positive, they can reach out to medical care providers regarding their own condition. Since summer, you'll learn that OSU has expanded its sampling efforts to include wastewater analysis. Today through more than 40 Oregon communities in an effort to provide for an ongoing evaluation of the COVID-19 health of Oregon communities, some of which are rather small and may not get the attention that larger communities such as Bend or Redmond might have. You will learn today how we do TRACE community. And as journalists, I would offer and ask for your collaboration in what really is a form of diagnostic evaluation. You'll learn about how our TRACE team members go door to door, reaching random households in the Redmond community to ask individuals in the community to voluntarily participate in testing. We are required by the permission granted by the university's boards of research evaluation to not allow photography of individuals who are being approached to be tested or who have agreed to be tested. So we would ask the media to honor that confidentiality. You can imagine that if you were an individual being tested, that you have personal rights to your health confidentiality. So at the end of our press conference, we'll discuss with you ways that you can actively cover the random sampling that will occur this weekend in Redmond. Before I move on and introduce our speakers, I'd like to share one important commitment of Oregon State, and and point of view. Trace COVID-19 testing is but one measure in our state and our community's arsenal of ways to inform itself and to guide ourselves to safer and healthier communities. We don't consider testing a replacement of vaccinations. Vaccinations and testing are part of the arsenal of activity that we should all engage in, as well as public and personal health measures such as wearing face coverings. So without further ado, I'd like to first introduce Tyler Radnicki. Tyler is an associate professor in the College of Engineering at Oregon State University, and within the college, professor in the School of Chemical, Biological, and Environmental Engineering. It is Tyler who has been leading the wastewater analysis throughout much of Oregon. Welcome, Tyler. You'll need to unmute.
So thank you, Steve, for that introduction. It's a pleasure to be here today to present to you what we are doing now in Redmond. So the plan that we have been doing, so we have been monitoring the wastewater at the city of Redmond at both the wastewater treatment plant as well as in individual neighborhoods. We've divided the community up into 5 distinct neighborhoods. And what we have been doing is been testing for the SARS-CoV-2 virus within the wastewater. So that's the virus that causes COVID-19. We have been monitoring Redmond on a multi-times a week since early December. And so we've been keeping a fairly close eye on the community and with their partnership since December. And that information has helped inform the design of our testing strategy going forward for this weekend. We plan once again to test at the wastewater treatment plant, which will give us an idea of the low level of virus in the entire community, as well as in individual neighborhoods, which will give us some idea of the spatial distribution of the virus within the community. I just want to quickly point out that this work could not be done without the extremely close collaboration of the Redmond wastewater treatment facility and staff. They have been fantastic in helping us with sample collection and getting access to the samples, as well as there's been a close collaboration with the Bend wastewater treatment facility in helping loan extra equipment and providing extra staff to help make these sampling possible. And so with that, I yield the floor.
Thank you, Tyler. It's my pleasure to next introduce Jeff Bethel. Like Tyler, Jeff is a principal investigator in OSU's TRACE study. And it was really Jeff and a handful of faculty at the university who last spring understood the importance of understanding the prevalence of the virus that causes COVID-19 in our communities to help inform communities and city leaders and public health officials. His efforts have really led to safer communities and where we have worked in response to outbreaks of the virus in places such as Newport and Hermiston. It's now my pleasure to introduce Jeff Bethel.
Thanks, Steve. Good afternoon, everybody. Yeah, so as Becky Johnson mentioned earlier, we've done TRACE in 5 previous communities, and we've done this over 10 different weekends. So Redmond will be our 6th community and 11th weekend of data collection. And we've learned a lot since April, not only on how to conduct TRACE, but also determining how widespread SARS-CoV-2 virus is in different communities. We've been learning about how the number of percent of our people who test positive do not show symptoms. So an asymptomatic infection is an important part of how to control the epidemic. So we're excited to come to Redmond this weekend. So what the community will see this weekend is we have 30 teams, which include 2 members. One, our team lead. This is a person that has a background in medicine, health, public health, or community health. And they lead the interactions with the households. And they're accompanied by a OSU Corvallis student or an OSU Cascades student who's there in a supportive role. So the teams will, each team is assigned to a randomly selected neighborhood in Redmond. And they'll go out to that. They'll then approach a random sample of households within each of those neighborhoods with the goal of collecting samples from 12 different households. And our teams will be in marked OSU vans and SUVs, and they'll approach the house. They'll invite all the residents in the household to participate. It's completely voluntary. Participants will sign a consent form, then conduct a brief interview with some demographics and symptom history and some contact information. And then participants will collect their own nasal swab specimen with our team at all times, maintaining social distance outside the home, at least 6 feet back. So participants will collect their own sample. That will go back to the lab in Corvallis for testing. And participants should receive their results between 3 and 5 days through various means. Everybody gets it by mail. We also have electronic or notification via email and phone notification as well. All our staff are tested for COVID before entering the community this weekend, and we'll be coming up Friday for a weekend of data collection. The team is ready to go. And just as Steve mentioned earlier, I'll just reiterate that the team takes the privacy and confidentiality of all our participants extremely seriously. Given this is a voluntary participation is voluntary, and just want to ensure everyone that privacy and confidentiality will be maintained. So again, we're excited to come to Redmond this weekend.
Thank you, Jeff. At the end, we'll offer opportunity for where media can actually talk with faculty such as Jeff or team participants as they prepare to leave to visit those 30 neighborhoods in the Redmond community. But we again ask that photography not be provided for during the testing. If I recall right, Jeff, we're anticipating testing approximately 600 people over the weekend. Is that right?
Approximately, yeah. It depends on how large the households are and how many people want to participate. So it varies, yeah, but about that.
Thank you very much. It's now my pleasure to introduce Dr. George Conway. George is the director of Deschutes County Health Services, and he and his agency, and really the Deschutes County Commissioners, have been instrumental over the last several months in OSU's efforts to understand COVID-19 health, first in Bend and now in Redmond. Thanks to his invitation, we're able to do the sampling in Redmond this weekend. George, the floor is yours.
Hi, good afternoon. So as I've mentioned before, this combined approach of increased testing of asymptomatic people and wastewater surveillance provides a lot of insight into what's going on. So by way of background, Redmond, with its population around 30,000 people, is less than a sixth of the population of Deschutes County, but it's been accounting for 1/4 of the COVID-19 cases cumulatively, and more recently, 1/3 or more of the cases. We also saw, as Dr. Radnicki mentioned, what we call a strong signal for waste in the wastewater for the presence of COVID in the community. And it was interesting because it was more homogeneous or more spread across the community than what we'd seen in some other locales. So for those reasons, we're really grateful that OSU is willing to do the technical support for the wastewater testing and the Redmond wastewater division for actually doing the sampling. And this should give us a better, what we call geospatial. So the physical distribution of cases, possibly helping us to hone in even into neighborhoods that might require special outreach and special assistance, and give us a better idea about the distribution and the concentration of cases, and therefore perhaps the chance to intervene and assist with any risks that appear to be there. So thanks very much, and we appreciate the collaboration.
Thank you, Dr. Conway. It's now my pleasure to introduce Mayor George Endicott. George is the mayor of Redmond and has, as you learned earlier, has been very instrumental through the city in collaboration with the university and OSU Cascades in our wastewater analysis project, and now in trace community sampling this weekend. And I know as a leader who's contributed to the wellness of the Redmond community for some time. So George, the floor is yours.
Well, thank you, Steve. And I want to do a shout out to Becky. She knows that I'm one of the more infamous alumnus here in Central Oregon from Oregon State, but the Corvallis campus. And I want to warn the OSU Corvallis students that are coming over here, you might decide that you just want to transfer to OSU Cascades. And once you get a sense of how beautiful it is over here. You know, my message is quite simple. You know, we're an open and welcoming community. And I want to remind you that the COVID-19 virus, we're still learning about it. We still don't know everything about it. And all of these scientific studies are really important, and surveys are just vital to try and figure out exactly how it spreads, how widespread it is, the impact it's having. Hence these surveys that are going on here, and also the testing like you heard about out at our wastewater treatment plant. So all of those are vital. I'm going to ask our residents, as you see those young people, maybe not so young, come around, they're going to have name tags. They're going to be identified as OSU people, and that they're going to ask you, you know, to participate in this process. And if you choose to do so, I really appreciate it. If you choose not to, I'll ask you to be gracious, because these are, you know, mostly volunteers from what I understand, just trying to collect data to help us better understand what's going on. And one more shout out, if you go on the redmondoregon.gov website, right at the very top, our headline right now has to do with the testing this weekend, has a picture what the badges are going to look like and how the testing is going to work. So that's my message to you. Please participate if you can, and make sure that you treat people with respect as they cruise through our neighborhoods. Back over to you, Steve.
Thank you, Mayor. We do appreciate your support and the option for Redmond residents to participate, and the encouragement for them to do so. It is so very valuable for them individually and for the community's knowledge as well. So now it's our opportunity to open the floor to questions. We can do this in two ways. Media members who are participants can raise their hand within the chat function, the participant function, and Christine and I will recognize you. And I'll direct a question or those questions to members of our panel. You can also use the chat function to provide questions. So we welcome your questions, and whoever would like to go first, the floor is yours. Please raise your hand or provide a question in chat. Heather Roberts, what is your question? And I will repeat it so that the recording can have that if your voice is not well heard.
There's so much focus on the vaccine now that we have what's considered an effective vaccine to fight COVID-19. How important is this trace study and the tracking of the virus and the prevalence in our community when we're looking ahead to trying to fight it with a vaccine?
Thank you, Heather. So I'll direct that to George and Jeff. And the question is, in light of the vaccination programs being underway, how important is continued COVID-19 testing at the same time as vaccinations? Could you please share your thoughts? Start with George and then Jeff.
Sure. Well, the vaccine is still among us, and that means that we have to be cognizant of that. We have to continue to control it. It will be months, possibly even quite a few months, depending upon the supply chain, before we have a protective level or herd immunity level of hopefully 75 or 80% of the population vaccinated. And there's still no vaccine for young people for below age 16. So it's very important to maintain social distance, wear masks, and to be attentive to what's going on with the cases. And then we will continue, actually, as the vaccine is more widely disseminated and case numbers fall, hopefully we'll be able to go out of the surge status right now and go back to very complete investigations and contact tracing in hopes of really containing the virus as well. So doing this kind of effort that we're doing now is a good bridge between that surveillance and sort of localization of the problem.
Thank you, Dr. Conway. Jeff, anything to add?
Yeah, no, I'll just add that, what we're doing this weekend really represents a point in time estimate of how widespread the virus is in the community. And so that's useful information for right now. And as George Conway mentioned, the vaccine is in its very early distribution stage, and this information is really important, for right now and how to control spread.
Thank you. A question for Tyler. Tyler, we heard from George that there is some prevalence within Redmond as far as the overall Deschutes County reporting number of cases. Could you give us a sense of what you've learned since wastewater analysis began in December as to the viral markers and their levels within the Redmond wastewaters that you've analyzed?
Sure. So thank you on that. So just so everyone's aware, when we're talking about virus levels in wastewater, we can link that to prevalence, but we can't quantify prevalence yet with that. So I can't tell you exactly how many infected individuals are in a given community or neighborhood, but we do see a positive correlation of when there's more virus in the wastewater, we do see more recorded cases of COVID in that area. So it's a very useful tool in that regards. As far as Redmond, so we've also been following Bend quite closely since before December. In fact, I believe we started back in August and September. And one thing that you observe in these communities is across the state, communities will have peaks and valleys in the virus concentrations that are coming into the treatment plant. But with Redmond, one of the things that we observed since early December is there hasn't really been much of a valley. It's been fairly consistently strong, fairly consistently high for about 2 months now, which tells us that the virus is reasonably well spread and continuing to spread within the community. And the viral numbers have been on a relative scale higher in Redmond than we've been observing in Bend, for instance, when we've been doing these analyses. And so that was one of the reasons why we were considering Redmond for continuing surveys, such as what we're planning to do this weekend, is because we have seen a pretty consistent signal that has been reasonably widespread throughout the community, as far as we can tell when we were looking at individual neighborhoods.
Thank you, Tyler. A question for Jeff. Jeff, from your experience and the other communities that TRACE has tested, and sort of building on what Mayor Endicott offered in terms of folks taking advantage of the option to be tested, what would be your expectations for levels of participation? How has it ranged in participation, say, from Bend to Hermiston to Newport to Eugene, and possibly for an estimate for Redmond, if you could?
Yeah, our participation rate has ranged pretty widely across the 5 previous communities. From in the around 50% to in Corvallis up to around 78 to 80%. That's in Corvallis, we have a lot of recognition of OSU. It's right in our backyard, so that's not surprising. But our teams have experienced everything. People, they decline in various ways, and they'll say they'll agree to participate in various ways. So we just want everybody to know that it's voluntary, and we would love for you all to participate this weekend, because the information is really valuable to help control the spread of COVID. Not only as for the entire community, but for the individuals that participate, they'll know their infection status within a few days. And that's important for their wellness and their friends and families' wellness as well. So we encourage you to participate. And just one more thing, we are going out, we've been saying this weekend, but we are going out Friday afternoon as well through the weekend. So if you see our cars, it's us. We'd love for you to participate.
Thank you, Jeff.
Steve, this is George. I'd like to make a comment here, if you don't mind. I participated in the drive-through testing that happened at the fairgrounds a couple of weeks ago, and I just want to comment for those that are interested in the test. When you go to a doctor's office or a center and get the test, feels like they're tickling the back of your brain, whereas I think these self-tests, it's just a little bit inside your nostrils, so it's not one of those very invasive tests. It's a pretty simple, straightforward, and quick one. So I just want to assure people, those of you that have had the one where they feel like they're touching your eyeballs, it's not the same one.
Mayor, you're exactly right. Thank you. So we have a question from a television reporter in Bend. The question is, OSU has done this research analysis in several cities now. What have you learned? And is this trace community work worth it? It seems like the results tell us what we already know. Jeff, would you mind taking that? And then Dr. Conway, possibly after.
Sure.
Related to the value of sampling.
Yeah, I think like I was getting at before. I mean, we see trace providing value in two different ways. One, at the community level, and secondly, at the individual level for the people that participate. At the community level, we provide timely information about how widespread the virus is in a community, and that's information that coupled with wastewater, that's information that the local health departments can use to make change or to make decisions depending upon the results of the prevalence that we estimate. So and we've learned, as I was saying before, we've learned about what percentage of the people who test positive don't show symptoms. It's been quite high as 50% in some of our communities. And that's really valuable information to help control the spread. That's just contributing to the knowledge about the virus. So we do see a value here now, particularly coupled with wastewater. We've been doing, since the summer. We're gonna further the knowledge about that association or that correlation that Tyler was mentioning between, the wastewater results and the results from from participants submitting samples and those test results.
Thank you. And Dr. Conway.
Yeah, I'm happy to try to answer that as well. So the thing that this sort of deliberate, statistically designed to be valid statistically for a community gives us is a cross-sectional surveillance snapshot. So it should give us a more precise estimate of how common the virus is in the community. So as far as telling us something that we already know, well, it's possible it'll be confirmatory, but it's also possible that it will surprise us or that it will better inform us so we have a more granular idea about the distribution. The other thing is that the testing data that we get, and even the case number data, is largely dependent upon people either feeling that they've been exposed or feeling ill or just being curious about their testing. So it's something that can happen more or less anytime unless someone is quite ill, in which case hopefully it does happen. Whereas this is a cross-section that's very systematically organized. So I think that our hope is that we'll have a much better view, and whether that's a confirmatory one or gives us new information for action, which is why we do any sort of disease surveillance, remains to be seen. Thank you.
Thank you, Jeff, and thank you, Doctor. A question related to face coverings. In the last several days, week or so, we've heard health experts now recommending double masking, saying that a single layer of a face covering is not enough. Could any of you comment on the importance, the benefit of double masking, if you will? Dr. Conway?
Well, I think it depends on the material. There's two reasons why the double mask can be recommended. One of them is that there's still a shortage of N95 masks, the medical and occupational level masking. And because of that, many of the masks that are being put into use have a valve, and so they protect the wearer, but the valve is when you exhale. So if you're exhaling, then it reduces or eliminates the protective value of the other person across from you. So we're putting surgical masks over those so that you have both the protection of the wearer and others. The other reason to either use an additional mask or perhaps more efficient would be making sure that you have a multi-layer mask, is if you just have a single level of cloth, it's still possible for some amount of the microaerosols to get through. Now, when you cough or sneeze, even a single layer of cloth is going to catch the large droplets. But especially if you're wearing them indoors, if you're shopping or whatever, and you're not very far from other people, even if you're not coughing or sneezing, but you're breathing, or if you're going up the stairs inside a building, for example, if you're breathing in and out a lot, it's possible that some of the smaller particles, which we know not only can be infectious and potentially at a very high dose, even when people are asymptomatic, but we also know that those fine particles can stay suspended in the air, and there is a chance that those would infect others.
Thank you. Jeff, anything to add?
No. George.
Thank you.
Yep.
A question for Becky Johnson. Becky, share with us the benefits you see that students attending OSU Cascades will receive by being participants in the sampling that will occur over this weekend in the city of Redmond.
Yeah, thanks for that question. We're a small campus, but being associated with a large Research One university does open up a lot of opportunities for students to get engaged in research. And this is just one of those examples. But they can see the level of coordination and planning and execution that a study of this magnitude requires. Bringing together 30 teams of 2 people to travel across the state and set up a random sampling across a city like Redmond. There's just so many aspects of research design that goes into that our students are now exposed to. And then participating on the teams, they're going to see what that interaction is like at every household and the kind of responses that people in different neighborhoods are going to give to this type of a study. And they're going to learn maybe the kinds of things that people are scared about or nervous about, and why they wouldn't want to participate. And that'll help design, this study to be even better in the future. So it's just an incredible opportunity, and it's an example of how our connection to OSU brings benefits to Central Oregon and to OSU Cascades.
Thank you, Becky. So I don't see any other questions from the media. Let me offer a couple of closing remarks. This weekend, beginning Friday afternoon, the sampling will be undertaken. Crews from OSU Cascades and Oregon State University will gather at the Central Oregon Community College campus in Redmond and receive instructions, and then depart from COCC's campus in Redmond to go to their assigned neighborhoods. Faculty such as Jeff, you'll be in Redmond at that time, is that right? Will be available for interviews after they've been able to do their work with the crews. Christine Coffin from OSU Cascades Communications Department will be on site to assist media in reaching out, for example, to Jeff or others from Trace community. We'll also work to provide interview opportunities with community health professionals that are part of the teams that go into the communities, as well as students from OSU Cascades in Bend and Oregon State University in Corvallis. So the opportunity to personalize this story. I suspect that there'll be folks from City Hall on site as well. So it could be that members of the Redmond City leadership would be available as well for media to interview. Photography opportunities would be at Central Oregon Community College. Again, as Jeff and I have tried to stress, what we're engaged in is a form of confidential health analysis of individuals. And we ask that you respect that and not seek to photograph people being tested or in the neighborhoods. The crews have been instructed, as they have in our testing in Corvallis and Bend and Hermiston, Newport, Eugene, that if media do find their way to neighborhoods to film, which we understand your interest in doing that, but we have to provide for confidentiality. The crews will shut down their sampling at that time and wait for the media to leave. We're not trying to restrict your job from doing reporting. We do have photography showing sampling being taken, demonstration videography that we can share with you. And again, you can interview Jeff and others from OSU, community health workers, as well as students participating in the study. Just, we cannot allow the intrusion of confidentiality as people are being sampled in the neighborhoods. As Jeff said, the results of the testing will be provided first to the individuals that participated from the Redmond community by mail and by email. And then shortly after they're notified, Jeff, would you imagine within our news release about the results would come out approximately 5 to 7 days after this weekend?
Approximately, yeah. Yeah, maybe the early of the following week, but yeah, about a week.
So approximately as late as February 8th or 9th. That information will provide prevalence estimates as well as media contacts from folks like Jeff, Dr. Conway, Tyler, and others. If we could show a slide in closing, this provides information on how to reach me, my email address, and my work phone number and my cell number. I think it's the very, so here's my email address, steve.clark@oregonstate.edu. If you want to get even something I've done bad to you in the past, you can call me anytime, night or day, on my cell, 503-502-8217. That number's 503-502-8217. Or at work, 541-737-3808. On Friday afternoon and Saturday morning, Christine Coffin from OSU Cascades will be at Central Oregon Community College in Redmond campus to assist media in your efforts and your important work to cover this. We thank you for your participation today. Thank you for your coverage of COVID-19 matters of importance throughout Oregon. Please remain well, and thanks to each of the panelists for participating today. Stay well, everyone.